In case study number 1, a 22-year-old male arrives at an acute care psychiatric facility transferred from an emergency room on a mental health warrant. He brought himself to the emergency room after making deep lacerations on his wrists requiring 12 stitches. His current stress is due to his recent breakup with his girlfriend and his loss of job. The patient reports depressive symptoms for the past 2 months, including social withdrawal, insomnia, anhedonia, and decreased appetite. The patient currently blames family members for a breakup with his girlfriend and has reportedly made verbal threats to family members. The patient is an alcoholic who just completed court-ordered chemical dependency treatment lasting 3 weeks. There is a history of previous suicide attempts and assaultive behavior, which led to the patient being jailed. In the interview, patient is vague regarding recent events in history. He denies intent to kill himself, but admits to still being quite ambivalent about it. Diagnostic impression, antisocial personality. Does case study number 1 have the highest risk factor for suicide? In case study number 2, a 30-year-old male arrives at your acute care psychiatric facility from his place of employment by a coworker. Patient has been thinking of suicide all the time because he can't cope. Has a knot in his stomach, sleep and appetite are down, only sleeping 2 hours per night, and plans to shoot himself, jump off a bridge, or drive recklessly. Precipitating events include constant fighting with wife leading to a recent breakup and a long history of mutual verbal physical abuse. There is a history of a serious suicide attempt 3 years ago where the patient jumped off a ledge and fractured both legs. The precipitant for that attempt was a previous divorce. There is a history of chemical dependency with 2 courses of treatment. There is no current problem with alcohol or drugs. Patient is tearful, shaking, frightened, feeling hopeless, and at high risk for impulsive acting out. He states life isn't worthwhile. Does case study number 2 have the highest risk factor for suicide? Case study number 3, a 19-year-old female found by a roommate in a sluggish state. The patient had ingested 10 sleeping pills, Sominex, and 1 750 milliliter bottle of vodka. The patient has been struggling with college courses and recently stopped attending. The patient has been giving away her possessions and has written a suicide note. The patient's blood alcohol level is 0.25. For the last 4 or 5 weeks, there's been sleep and appetite disturbance, with a 15-pound weight loss and subjective feelings of depression. The diagnostic impression is adjustment disorder with depressed mood versus major depressive episode. The patient states she is refusing hospitalization at this time. Does case study number 3 have the highest risk factor for suicide? Carefully assess all the 3 case studies and make your case for the patient with the highest risk factor for suicide.
Created using Powtoon.